cases that we think of, LASIK can be done for cases of very high powers, do you feel?
Not very high power, but definitely we have cut off around -7, -8, until which we can do LASIK. And when it comes to plus numbers, the cutoff is much lower, like plus 3.5 or plus 4. Because what LASIK does, it thins out the cornea. So we don't want the patient's cornea to be so thin that it protrudes afterwards, and that can lead to minus number coming back. What do you think?
I agree with you completely that a cutoff of 8 is good, -8, and for the plus side around 3, and there are other criteria too. Yeah, I completely agree with you. And beyond that, what do you feel are the options which are there?
Multiple
If a
options,
patient
yes.
comes to you, let's put a scenario to make it a bit more understandable for the people who are they're viewing this. Suppose if I have a patient who is around -5 with a cylinder of -3, everything else is fine, but the corneal thickness is around let's say 500. What would you do?
Yeah, in that case, definitely we'll have to think of other modalities like ICL, and it being a very borderline case if you take the eventual number.
Yeah.
So rather than taking a chance, we want the patient to be absolutely safe and have a good treatment done. And apart from that, there are so many factors like corneal thickness, their pentacam reports, so which takes a big part in the decision making. But definitely there is an upper limit to what we can treat and not treat.
This was a very important point which we want to cater to, and regarding this, both of us are in the consensus that a patient of a power of -8 would be the upper side and a patient of +3 would be the upper side. More than that, it is not about having a power which is within this range. There are more factors which play a part in it, especially coming to the criteria of the whole eye as such. The patient's eye should be fit for even that. Even if a patient has a power of a 4, but if the corneal thickness is less, the patient is not going to go for this. I mean, at least that is what the patient has to understand, right?
Absolutely.
That's what I feel. We are in the consensus, and I'm sure that this is the protocol followed and should be followed. The patient should understand.